Good?
Yep.
Okay. Welcome. I hope you can hear me. I feel like the acoustics are kind of weird in here, so, and I don't like talk super loud, so we'll just give this a shot, and I can repeat things if you need me to. I also tend to forget sometimes as I'm going through, so I have my notes here. But thank you so much for your interest in becoming a foster parent to animals that require medical care. With the help of all our medical fosters, we're able to expand the number of animals that we can treat and the level of care that we can give these animals. This class is designed to cover basic nursing skills for medical cases, specifically cats, that are residing in foster care. Medical care can range from administering a course of antibiotics over a couple of weeks to managing diabetes for several months. It can also include hospice care, providing care to an animal with terminal illness. The topics that we're going to cover today will include administering eye medications, cleaning ears, administering ear medications, administering oral medications, administering subcutaneous fluids, giving insulin injections, and post-surgical and wound care. And everything should be included in your handout that I gave you. I kind of took it right from my notes and just broke it down into little pieces. What I'm going to do is go through everything with my little stuffed friend, and as much as I can. And then at the end, I'll pull Henry out, and I just don't want to stress him too much by pulling him out again and again. So we'll just do it at the end. When I go through everything, I'll bring him out, and we will then go through as much as we can on him. Hopefully it won't stress him out too much. He's very sweet. So first things first, I know I recognize a lot of you. I know a lot of you do foster animals, and a lot of you do already fostering medical cases for us. So some of this might be repetition for you, but the most important thing, I just want you to know that you are supported by the staff here at the shelter and by the clinic. So I may repeat that several times. I just want you to know that we are here if you have questions, if you're unsure of something, if you need an extra demonstration on how to do something. I fully support you in that. So feel free to reach out and contact someone here in the shelter, and I will be able to get together with you to do that. I also want to let you know that we provide all your materials as far as your medical materials, medications, and things that you need to care for those animals. The first important thing is you want to minimize stress on your animal. The medical treatments need to be given regularly and consistently. In order for them to be most beneficial to a recovering animal, we want to give them as scheduled. So whether it's every 8 hours, twice per day, however we instruct you to do that. And then again, communicate with the shelter or clinic staff any concerns or any questions that you have. So where to begin? So when we call you, we'll go over a case with you. The staff, or either the shelter staff or the clinic staff, can go over the animal's medical history for you. We'll review all the medical instructions and provide you, if necessary, with a treatment sheet where we can outline what you need to do at what times of day, and really break it down for you so you know what is going to be required of your case. Some care will be very time-consuming, while other cases will be more flexible. Be sure to know your level of availability to care for each patient that you have. If you're away from the house for 14 hours a day, it wouldn't make sense to take a case that needs medication given every 6 hours. They do work best when they're given at consistent, regular intervals, like antibiotics, keeping a steady stream of antibiotics in the body. So that's why we stress, make sure that we're giving them as close to the instructed times as you can. And also, if they're receiving pain control, we want to give that regularly as well so that we stay ahead of the pain and it doesn't build up, and they can stay more comfortable and less stressed. And the least stressed they are, then the faster that they'll heal. animals requiring medical care need it because they've sustained trauma or they've had a complicated medical procedure. They tend to be more stressed, more painful, and likely more fearful than a normal, healthy animal. They might try to hide or be difficult to handle when you first bring them home. Make sure you go slow. You want to place the carrier in a quiet place in your home, maybe a bathroom or a room that nobody uses, where you can close the door and give them time to come out of that carrier on their own. Keep them away from other animals, and they will eventually come out. Some important notes on cats. Cats, normal healthy behavior, they're playful, they're curious, they're spicy, they are more active in the evening and sleepy during the day. Painful cats will be very quiet. They tend to hide, they'll crouch away from people. It's just important that you sort of recognize where your animal is comfort-wise. I've listed a few reasons that you would call the clinic if you were concerned. Obviously, any difficulty breathing, that you would want to call us right away. If it happens off hours. Do we have an off-hours contact for foster animals? Okay. Okay.
On the adoption contract.
Okay, great. Okay, so we can address that if it happens, something after hours. If they're not eating or drinking, if they're not eating for more than 24 hours, that's definitely something we want to keep an eye on. Vomiting, diarrhea, lethargy lasting for more than 24 hours. Some pain medications will cause sedation, but if you're concerned, definitely give us a call. We can go over that. And any seizure-like behavior, whether it's like profuse salivating and they become rigid, they're falling over, they're unable to walk, those would be reasons to call and talk to someone as soon as possible. When in doubt, if you see something that startles you, call the clinic or shelter staff and we can address that. Handling. So handling is always the fun part. You want the least amount of restraint possible to minimize their stress. I find like the most efficient way to handle cats for medicating. I know this is a dog, but I was grabbing it when I was in the house this morning and we had no cats available. So I think, coming from the back, having them in front of you and coming kind of from the back side, you're patting them a little. And if you can grasp the head or however you need to do it, you want to be firm, but also, gentle. Most likely they will absolutely never want you to hold them to give them eye meds or ear meds or pills. So they will catch on very quickly to our methods and they will try to sabotage them. So you want to be quick, kind, and efficient. So with cats, I find there are some cats you're going to be able to hold without a lot of restraint. But most often, my go-to is a towel, and I would use a regular sized towel. My patient's so tiny, I got a little one. And you're going to start with them kind of on top of the towel, and the trick is to make sure you get those front paws down in, because those are the ones that they'll swat you with. And you're kind of burrito wrapping. And I do this by covering up those front legs and then just making them nice and snug in a little burrito. And this will enable you, hopefully, to kind of keep their feet. I sometimes will get my hand under there to kind of hold those legs in there. It's not foolproof. They can get out of anything. And then I try to just have them against me. And this will enable you to tip their head back, access an ear, and that will definitely help. The towel is, or even you can use a big, like a fleece blanket, something that makes them feel, tight and secure in there. You can scruff them, but they prefer that you don't. You don't like it. Scruffing a cat.
Oh, just at the
Scruffing the neck, yes. You can do it
I read that and I was like, oh.
No, scruffing a cat is grabbing them is where you can hold them by the back. They don't like it, but so we try to avoid that if we can. But usually the towel wrap helps really well to get in there. With eye medications, they come in liquid, ointments and gels, and they're different types of bottles. Commonly you'll have a small tube like this. This is ointment, and what we recommend, this is very pointy, so when you're administering this, if you tip the head back, they're squirming a little, you might poke them in the eye. So one way to do this is to put a dab of it right on your hand, on your finger, and then use your finger to put that into the eye. And that helps to, try to keep them from getting in there and not getting poked in the eye and when everything's moving. So some of the gels don't have that pointy tip, so you can just kind of tip it back and just drop it in there. It's a lot easier. When we move on to cleaning ears, the same thing. You always have this moving target, so you are going to fold the ear back so that you can get down into the canal, and then you're going to take your ear cleaner that we'll give you. Some of them are medicated, some may not be, and you're going to sort of fill the ear canal. It's small, but so you're using a couple of teaspoons in there. And you get it down into the ear, and you're going to massage the base of the ear and just kind of try to work any wax or debris that they have. You're going to try to loosen it with that fluid and massage it. I say usually try to massage it for a minute. If you get 15 seconds, you're doing really good. So you'll massage it like that, and then they are going to want to shake their head immediately. So when you've massaged enough in there, stand back a little, hold on, but let them shake their head and close your eyes. I always say that because you don't want this stuff going in your eyes. Close your eyes, close your mouth, and they're just going to shake. And then you can use some gauze and just gently go in and clean out any of the debris that you see in there. And then you'll repeat the same on the other side. Here, what's that?
How far do you go in with the gauze?
I say gauze and not Q-tips. Q-tips can go too far, and Q-tips can break off, and then we have problems. So with gauze, you're taking your finger and you're going in there. You're not going to hit the eardrum with your finger. So you can get right in there and clean out the creases and pretty much as far as you can go, and you're not going to hit anything. You're not going to damage anything, but don't use Q-tips because, again, they can break, they can scratch, so best off just to use the gauze. Things like deep cleanings, we can do that here, and that way it'll save you the trouble of worrying about, poking anything or doing any damage. Ear medications. So we'll have different ear medications, and again, a lot of them come in a tube like the eye medications. There are some medications that we apply here, and we'll let you know ahead of time if you go home, if your animal that you have has had an application of ear medication. A lot of the medications that we apply here are good for 14 days to a month. So you don't want to do any ear cleaning during that time. You want the medication to stay in there. So if you go home with ear meds, it's usually a little tube like this, and once you get that tube into the ear, you can't see how many drops you're putting in. And that's the one thing I hear a lot from foster parents is, how do I know how much I'm getting in there? So before you actually administer the ear meds, see how fast it's going to come out of that tube, and then just make your best guess. So if it's 3 to 5 drops, go in there for a second or two and just administer a few drops. If it's like 0.5 mils or something like that, again, you're using your best guess. If you're squeezing the tube for a minute, you're probably using way too much. So you want to just try to do just a little bit, and just, again, gauge before you actually put it in how much you're putting in there, the best you can. Like, sometimes, more often than not, they're probably getting more, and it's still going to be effective. I think it's unlikely that you're going to give too little when you do it. So that should work sufficiently. And again, so you get the ear meds in, and then you're going to massage it just like you would if you were cleaning the ears. You're going to massage that base of the ear and kind of squeeze and massage that. And they're going to shake their head. When they do that, and close your eyes, close your mouth, kind of look away. Some ear meds can be toxic if they get in the eyes. So just keep your eyes closed and be aware of that if they're shaking their head. And then sometimes what I do is I might, if there's a little bit around the outside of the ear, I might just kind of wipe that a little so it's not dribbling all over the place. Just as long as you're not wiping down in the ear canal after medication application, then you'll be okay. Most cats will tolerate eye medication and ear medication far better than they will oral medication. I have been a technician here for a couple of years, and killing cats is still my least favorite thing to do. Typically, what I do is you can use pill pockets, and sometimes they will eat them. Sometimes we have pill pockets here. We can get them if you want to try those. This is just a treat, just pretend it's a pill. So I usually will come from behind again and just try to pry that mouth open just a little bit, and I shoot it down there as quick as I can, and I'll grab my syringe, which has a little bit of water in it. I'll have it ready to go. So then shoot a little water in there and kind of close their mouth and massage the neck a little, and that helps it go down. Lots of times they're very quick to spit them out, and they will go flying, and they'll get mushy, and you'll get frustrated. You'll try again. Once the pills start to get mushy, they taste terrible. So the cats might start foaming. If you need a break, just step away from it for a little while and go back. It'll be easier on all of you if you just give it a little bit and try again. And use a new pill if you have to, if that one's kind of in 15 pieces on the floor. No need to pick them up and do it every single time. Just grab a separate pill and go and try it a half hour later.
So should you have your hands all wrapped up at this point, so he's not
Yeah, so you have your, wrap your hands all up in a towel. And no, it's very cumbersome sometimes. And you will find a technique that works better for you. Sometimes, some people don't need to squirt water as a little chaser. Sometimes the cats, you get it right in, you can massage their neck and it'll go right down. Sometimes they'll eat it in their food. I don't like to put it in the food and then walk away because you can't guarantee that they're going to eat that. So definitely trying to pill them is the best way to get that medication in there. Sometimes if you're having a really hard time, we might have alternate treatments that we can do if you just can't get the pills in there. So we can always investigate that if it's just not working.
What if it's powder form? You're supposed to put it in that food?
So, for example, Fortiflora. If you're administering Fortiflora, it's in a packet. It's a very small packet. It says give a half a packet with each meal or with the morning meal. You can sprinkle that right on the food, and it smells like prime rib or something. I don't know what they make it out of, but it smells really appetizing for the cats. They usually gobble that down. If there's something else, I know there's sometimes, I don't know if it's Cosequin or something that comes in a little capsule that you can break onto food. Yours is a powder in a bottle. So, I mean, those things are best to mix with the food. Hopefully you have a cat that will, it gets really hard. You might try mixing it with a little water and shooting that in there. That might work for you. That might be the best thing to try. And then maybe have, some food on hand if it tastes bad. I mean, I don't know how powders taste. I just know they usually eat the fortiflora without problem.
I've given powders before and I've mixed it with a little of the beef or chicken beef.
I like that. That's a great
And
idea.
they gobble it right
Sure, that's a great idea. Okay. Yep. If you're measuring oral medications, you want to make sure that you know how you're measuring them in the syringe. When you take your syringe, we have special like oral syringes as well that will have covers. Sometimes you'll be given medications that are pre-measured for you. If you have any questions about making sure that you've got the right amount in your syringe, we can go over that with you when you pick up the cat. Typically, you go into the top of the black line. So for example, this would be a 1/2 milliliter. I can pass that around so you can see where that measures to. Just to give you an idea when you're measuring it. If you're given tablets, and it says give 1/2 a tablet every 12 hours, typically we already have them for you, so you won't have to break pills or anything like that. Again, if you have any questions, just ask us about that. But most of the time they'll already be split for you. Make sure you know if the medication should be refrigerated. We do stick a little sticker on it if it needs to go in the fridge. That will just make sure they can go bad if they're not. If they're preservatives, they can go bad on that shelf. Also make sure if it says to shake it that you thoroughly shake it really, really well before giving it. And also some medications need to be given with a meal. So you want to make sure that you're giving them a lot of anti-inflammatories can upset the stomach. So you want to make sure you're giving them some food before they get that. We can also, so some medications will have side effects. They make them drowsy or a little nauseous or something. We can go over side effects with you, and if you're seeing any behavior that you have questions about, just give us a call and we can go over that with you.
Is there ever a situation where you could take a pill and crush it and add it to water into a...
Sometimes you can. Some are like a long release, so you don't want to do that, but some you can. Always just give us a call and ask us, and then we can let you know if that's a type of medication that you can crush up and do it that way. Sure. So moving on to subcutaneous fluids. Subcu fluids are a method of hydrating an animal that's dehydrated. So we would send you home with a bag of fluids and an IV line. And when you administer them, they're just going just under the skin. So you don't have to worry about veins, muscles, anything like that. You're just going under the skin, and you're doing, usually in cats, it's a fairly small amount. And you always want to make sure that you're using a new needle. So this doesn't have a needle on it, but always make sure that you're using a new needle every time you poke the cat. You're going to want to mark the bag with a piece of tape before you start. That way you know where you're starting. So I would stick a piece of tape. If I was starting, you want to hold the bag here so you can see where your start line is. So this is right at 1. So you'll want to mark that. And we will tell you how much to give. It may be 50 milliliters, maybe 100. So that this will give you your starting point. And you can hang it, the higher the bag is, the faster it will flow. It's a gravity thing, so if you can have someone hold it for you, if you can stick it to like a kitchen cabinet, something like that, would be helpful.
Do you need to do any antiseptic or anything before you
No. When you have a clean needle, you don't have to do any surgical prep or any kind of prep on there. You can just go between the shoulder blades. So again, you can try your towel wrap. Subcu fluids I find are always best when you have someone to help you. because you really need an extra set of hands to hold the needle in and to make sure you're getting the fluids in there, to hold the cat. So we typically would have the cat, you can try the towel wrap and just get into the back here. And you're going right between the shoulder blades. I'll show you on Henry when I pull him out, and we'll just give him a little bit of fluids. You're going to pull the skin up just a little so it creates a little tent here in the back between those shoulder blades. And that's where your needle's going to go. And it's going to just go under the skin, so you're not hitting any muscle, and the needle should feel fairly loose under the skin in there. And this is why I say you need some extra hands, because once you've got that needle placed in there, they're going to squirm a little. Typically, it's not painful to inject them right behind the shoulder blades. They might feel a little pinch, but it's not something overly painful. They will react a little bit to cold fluids going into the skin, or their skin stretching a little from the fluids. So having that extra set of hands to hold them helps. So once you get the needle in place, there's a little switch on here. You're just going to roll it up, and the fluids should start flowing freely through the bag. Again, the higher you hold it, the faster they'll flow. And it only takes a couple of minutes to get down to do a 50 or 100 milliliters of fluid. It's pretty quick. And then when you're finished, before you remove the needle, make sure you switch back off. I've done it 100 times, and you end up getting fluids everywhere when you pull the needle out, and they squirt all over the place. So you'll put these off, and then you'll remove the needle, and you want to pinch that skin and hold it pinched a little bit, because the fluids can start to come back out and run back out. You probably lose a little bit normally, but you just want to pinch that closed for a little while to help minimize the fluid loss. It's going to create a bit of a camel hump on the back of the cat, and you'll feel it in there. It's not it's pretty solid feeling, and they, like I said, they might react a little if it's a little uncomfortable. So just keep that closed for a couple of minutes, and then you can let them go. The fluid will take a little while to be absorbed by the body. That hump might move a little bit, that gravity thing kicking in, so it might kind of pull it towards the side of the cat, or down under his shoulder blade. Sometimes it will move a little before it gets absorbed, and that's all normal, but it will eventually be absorbed. So moving on to diabetic cats. Diabetes is all about regulation, and in a shelter setting, it can be very stressful for cats, and it's very hard to regulate their diabetes. So we place them in foster care often so that they can have a much less stressed environment, and be in a home setting. Some cats can go into remission, which means that they may be able to maintain their blood sugar levels on their own once they're in foster care. But they can also come out of remission. So we would never want you to stop giving insulin unless you're directed by medical staff. Diabetic cats often need regular medical visits. We'll do what we call a blood glucose curve. So we'd have you drop them off in the morning, and then we would check their blood glucose over the course of 6 to 8 hours, and to see how that insulin is affecting them, and if it's helping them, if we need to raise their levels, lower their levels. So they do need to come into the clinic quite frequently. We can arrange for those kind of tests, and we can let you know. Usually we have you feed them in the morning and give them their first dose of insulin, and then they're fine for us to do the testing throughout the day. Insulin needs to be kept in the refrigerator. When you pull it out of the refrigerator, you're going to want to roll it in your hand like this. Don't shake it, but you want to roll it just to mix it up, and roll it slowly and gently. You'll be given specific needles based on the type of insulin that you're using. So some insulins call for what's called a U100 needle, some use a U40 needle. That's the number of units in the milliliter of insulin. So when you're instructed on how much medication to give your diabetic cat, it would be 3 units of insulin. So these are different needles. They're very small. And they have the number of units written on them. So you'll draw up in the insulin 3 units. Then you're making your little tent in the back of your cat, and you're just going right under their skin and giving them the insulin. And then you just want to make sure measuring your insulin is the most important thing. So, like I said, 3 units, 5 units, whatever the dose is, that's what you want to check. And it should be given after the meal. I have listed on here some signs of low blood sugar. Sometimes when you give insulin, it may drop their blood sugar too low. So you want to keep an eye out for disorientation, confusion, tremors, shivering, low energy, loss of consciousness. Those would be cause to call the clinic right away, just to see what the next steps would be. One thing we usually advise you right away is to maybe put some maple syrup or Caro syrup on their gums. That will help to keep them from crashing. So just give them some of that, the sugar. That will help keep them stable. And then we'd have you probably bring them into the clinic so that we could treat them as needed. So it's just kind of watching them and making sure you're doing as directed, and then making sure you have the time to bring them for their appointments. Usually, like I said, just drop them off in the day. Yes.
So far you're talking about cats with diabetic care. Are there significant differences we should know with cat and dog that is diabetic?
Well, you are fostering a diabetic dog, is that right? No, you're not? Oh, I thought someone was.
Pregnant dog.
Oh, pregnant. That's right. You have the pregnant dog. Okay. Diabetic dogs are similar. They're similar, but again, lots of appointments. We have one right now, diabetic puppy, and she's very hard to regulate. It's very hard to regulate in puppies, so we see her often. So I would say we would go over that on a case-by-case basis. I'm not as familiar with the diabetic dogs, so yeah, I would say it's probably best to just go over it as needed. It's similar. It's very similar.
Would it still be in the shoulder blade?
Yeah. Yep. Definitely still in the shoulder blades, and a unit, the unit measurement, all that. Yeah. So does anybody have any other questions on diabetic? Yes.
What is the standard number of doses a day?
Most of the cats that I see right now they just get it in the morning. There can be cases where they need it twice a day, but again, it's case by case, so we'll just see, see how they do. Did you have a question?
Not about diabetes,
Oh.
in general.
Oh, okay.
I just wanted to have you, if you could comment on what I have found, which is your state of mind when you're approaching an animal, how important it is to be centered yourself and not front them.
Oh, and it takes time because you will. So the question is, how important is your state of mind when you're approaching to give care for an animal? You're definitely going to have a few jitters the first few times you do it. Once you've done it a few times, you'll probably be more relaxed. The animals always respond better with the more relaxed that you are. Is that kind of how you mean, like more or less? Again, cats like things to be done quick and fast, and let me go. So, I try to be as calm as I can when I'm handling them, relaxed. It definitely helps to kind of get things moving as quickly as you can. Yep.
Just one other thing is, what is your feeling about positive reinforcement? I've had a lot of sick cats myself, and I always made sure that I am combining it with the procedure of positive reinforcement, that this was a good experience for you all. So do you
So as far as positive reinforcement, I would say, a lot of cats do like extra affection. There are some cases where we wouldn't want to give, say, extra treats, or if they're on a specific diet, things like that. But there are other cases where, if they're healing from an injury, then you can definitely give them a treat if they like that. Cats are so different in how they respond, what they respond to, and some cats are just happy to be done and go away. So, you'll kind of judge based on the type of cat that you're caring for, what kind of works best for them. The last thing that I wanted to cover was just post-operative care. We do have cases where they'll have major surgery, and what we do is send them home. The instructions are on a case-by-case basis. You may see a case like an amputee, an eye removal, ear surgery, or major dental procedures. Sometimes you may have a cat that's had full mouth extractions. So there's, a level of pain involved and discomfort. Sometimes they require multiple medications, sometimes bandage changes, and usually follow-up visits to the clinic. There may be complications that we have to deal with as well in these patients. So you'll want to do a lot of careful monitoring of pain, urine output, bowel movements, appetite, water consumption, things like that. We can give a treatment sheet that will give you a little spot to mark all of that so that you know what you're looking for when you're looking for it. These animals sometimes have surgical drains in place to remove fluid from the body. They, what you want to look for is normal drainage, which would be clear, and it would be a trickle. It's not something that would pour out, of course. Anything that looks like pus is thick, foul smelling, those are reasons to call us with concern. These animals will probably have e-collars on, that you want to make sure you're keeping those on for 7 to 10 days. And it keeps them from licking the infected site and causing more infection.
So I had to do an e-collar with a cat once that was just so good at getting them off. Is there anything I could have done?
They are really good at getting them off. We use gauze to tie it around, and we just make sure there's about a finger width of space in there. They will get their legs in there. They will, they're contortionists in all kinds of things. We do our best to try to keep them on. We can custom size them using duct tape. All animals hate e-collars, so we just do the best that we can, and usually that's good.
What about using like a baby onesie?
If that works, you can do that, definitely. The most important thing is to just watch the animal and make sure that they aren't able to get to their incision site and that they're not licking. Yeah, definitely. If that works, I'm all for it. Sometimes they're on specific food. The most important thing with a prescription diet is making sure that you don't stray from that diet. So we'll let you know if they have to be on a specific diet. We'll let you know if they're allowed any treats and things like that. But in a case of, say, a cat that has a special urinary diet, you don't want to give Friskies dry food, because in that case, that cat might grow crystals in their bladder faster. It might cause more problems. So if you're given a specific diet, make sure that you stick to the diet that we give you in those cases. If there's bandage changes and things like that, those are most often done at the clinic just so we can see the progress of the wound healing. Occasionally there might be a cream or an ointment or something that you need to put on for healing, but we can, again, go over those on a case-by-case basis, and I'm happy to help with any questions that you have on those. So I think at this time, we can have our friend Henry come out, and I will try to go through what I can with him. Does anybody have other questions on anything? Have I covered things that you wanted to hear?
There's like one quick little
Yeah.
question, your wash. I have a gunky ear cat.
Yep.
And, the wash that I have the Otoplan,
Yeah.
or something like that, is there a homemade thing, once that's gone,
Mhm.
is there a homemade, blend that you can do? Because
I
it's-
generally don't recommend, only because changing the pH levels in the ear, you could cause more of an infection, you could cause yeast buildup. So I generally don't recommend, whatever you might find. I stick to medications that are tried and true and know what they're doing.
I've dealt with some good lab, and he told me it's just about anything.
Yeah.
I've dealt with a good cat.
Yep. Yeah, I try to just stick to it's what I'm used to. And I'm afraid of anything outside the box as far as, trying something that I haven't seen or that I don't have medical data on to.
I was just at the vet with my cat who doesn't lick ears, but the vet was like, it's not bothering her, so it's not cleaning too long, as long as it's not.
Right,
Yeah.
right, it just gets itchy and it's.
Yeah, it's bothering me, has to do it, so.
April,
Yes.
one thing I think that sometimes if they do a diabetic cat, you're supposed to wait until after they eat.
Mhm.
They don't want to eat their food right away, or, they won't eat. And I think it's important, you need to get to know that cat, because some cats, if you stay in there with them, maybe even pet them a little bit, they'll finish that food right up. So you'll find each cat is a little different. Some don't want you around, some want you there.
All
You know?
different. Yes, definitely.
So get to know it. So if it's not eating, try a couple different things as far as staying with it, changing where you put the food or anything like
I
that.
think those are great points. Yeah, definitely. All right. Beth, do you want to help me with Henry? Do you mind coming up and being on video?
Oh, wait.
I'm going to try to burrito him. This is so sweet.
Getting the cat out is really hard because none of these carriers go the same way. I can't remember.
Good, coming right out.
Henry, we're just borrowing Henry for a minute. He might not like it. We'll see how he does.
That's burritos.
So burritoing again is just kind of wrapping him really tight and keeping those front paws in here. And I tend to come from behind so that I'm right here holding him. If you want to, so with eye meds, I'm gonna just put some on my finger. Yeah, you need to talk. So put a little on your finger, and I don't know, he might not like this, but and then you can just kind of put a little. This is just a plain. There's no medication in that. Just kind of put it in his eye. Okay, just a little bit in his eye. And he says, "What's going on?" So there's your eye medications. This is just an ear cleaner. So I'm just going to do a little drop in him so that he doesn't get mad at me. That's a shame. A little in there, and then you're just massaging. It sounds all squishy in there. So you're going to massage that down in his ear. And that's so if you were doing medication, that's where you would want to stop. You wouldn't want to clean anything out. If you're cleaning his ears, just go in there and kind of wipe out goodness.
Dirty.
I needed that. Wipe out the ears. That's what I mean about closing your eyes.
They're really probably for those fluids.
Go in and clean that. there's your ear cleaner and your ear meds. Now we're gonna try to give him a pill. What's that? He might not want that. Let me see if I can break it up a little smaller. All right, so you're trying to
Yeah.
come in, and I kind of open his mouth and boom, and then just hold and do that. If you're shooting it with a little water, you just do that. So that's your pilling, and that was very easy for me because that was food. But that's the technique you want to get into, and once you do it a few times, you're going to get a little better at it. So we can show you Subcu fluids.
You have a needle.
Hold this up here. So if they need Subcu fluids, we will make sure that we'll send you home with fluids. You'll know if they need it and when they need it. Is that a new one? Well, it's smaller, and I pulled it off that syringe, so yes, it is. So when you're going in here to do Subcu fluids, you can feel the shoulder blades right here. And I just kind of pull up, right, that fur behind the shoulder blades. And you're going in this little spot that you make here when you pull up that skin. Just give me one little. Hold on, buddy. Okay. We're only going to give him a drop. So it goes right in here. Deep part in it, yeah. Should flow. Yeah, and it will flow. Sometimes you can move your needle around in there so it flows a little better. Okay, and then you can pull it right out, but turn it off first. And then hold that. I didn't put much in him. My cat go.
This is what games them to.
And so that's your Subcu fluids. And so your needles, when you're done with them, I usually tell people you can put them in like a detergent bottle. You want to label it, sharps. And then if you need to dispose of those, just bring them back to us, and we'll take care of them. So I think, any other things we can... No, insulin needles are very, very tiny. They're really small. So when you're doing insulin, again, the same thing. You're just kind of tenting that up, going right in here, and poking it in. He's a very good boy. Does anyone have any questions? Or
I have a pillar. Do they still
you
use
can
that?
use a pillar. Sure. A pillar
I love that.
is so a pillar is a long tube that has like a little plunger, so you can put the pill inside that, and then kind of put it into their mouth and shoot it in. If you have one and you want to use that, that's fine. But you'll come up with your own method of that, definitely. So that's an option. Any other questions? No?
Is Henry up for adoption?
I believe he is. He lives in the lobby. He's a wonderful cat, and a very good patient, who now has clean ears.
It's probably rethinking that whole being a good boy thing about.
He's kind of thinking, okay, you got me.
How about nails? Do you suggest bringing in, have them done, or doing them?
If they'll sit still for you to clip their nails, go for it. If you want them to be clipped by us when they come in for an appointment, or if they're especially long, just call us and we can do that. Yeah.
Burrito really helps because you can get one.
Oh, burritoing. Yeah, burritoing for nail trims is very helpful because you can just kind of pull out one leg at a time and meanwhile hold your cat close to you. So that's helpful for nail trims. Yeah.
Is there a particular clipper that you would?
I like they look like little scissors. They're very small, and I use those on cats. They're just a lot easier to hold than the big clippers, like the ones you use for a dog. No, they're very quiet. They're like little scissors, kind of.
They have that curve.
They have a little curve in them, yep.
Click on the end.
Marie, is there anything that you?
No, I just want to thank everyone for coming. And if you're an AWS foster, thank you so much for helping us out. If you are considering it, thank you for considering it. And if you're just here to medicate or treat your own cats, thank you for taking such good care of them. There are treats on the counter that one of our volunteers, Joanne, made. So please help yourself. And just thank you very much for coming. Thank you, April.
Absolutely.